Hi, I'm Esmael Gilis, and this is Hair, Hormones, and Honest Talk, the podcast where we talk about hair loss, hormones, and the honest answers that don't always make it into a 30-second ad. A quick word before we start. I'm a hairdresser. I've been behind the chair for 28 years, since the 7th of July, 1998. I'm not a doctor. Nothing I say today replaces advice from your doctor or your dermatologist. Think of this as the conversation you'd have in chair with someone who has watched a lot of women go through this and is willing to tell you the truth about what helps and what doesn't. Okay. Today's subject. A woman sat down in my chair this week, looked at me a little sheepishly, and said, "Esmael, have you seen the headlines about the pill?" She meant oral minoxidil, the pill version of the foam most of us already know. And this week, the headlines have been loud. One of them, from a science publisher called IFL Science, literally called it the biggest hair loss breakthrough in decades. The menopause forums online have been quietly asking the same question. Should I try it? Is this the thing that finally works? Did I wait too long? So today, I want to do something simple. I want to walk you through what oral minoxidil actually is, who tends to do well on it, who probably should not start it, and, most importantly, the 7 questions I would want every woman to bring to her doctor before she asks for a prescription. Not to talk you out of it, not to talk you into it, just to make sure that if you walk into that appointment, you walk in prepared. And I'll tell you why this matters to me. In 28 years behind the chair, I have watched a lot of headlines come and go. Every few years, there's a new miracle. Every few years, the phone rings differently for a couple of weeks. Women come in, sit down, and ask a version of the same question. Should I be doing this thing I just read about? And what I've learned is, the women who do best are not the women who say yes the fastest or no the fastest. The women who do best are the women who walk into the appointment knowing what to ask. That's it. That's the whole edge. Preparation. So today is about giving you that edge. Let's start with what it is. Oral minoxidil is not a new drug. That's the first thing the headlines tend to miss. It's the same molecule as the foam most of us already know. The difference is the form. Instead of putting it on your scalp twice a day, you take a small pill once a day. That's it. Same medicine, different door. It was actually invented for high blood pressure decades ago, and the people taking it for blood pressure kept noticing the same side effect. Their hair was growing back. So eventually, doctors started prescribing very low doses, off-label, for hair loss. And that has slowly become more and more common, especially for women. The doses are tiny. We are not talking about a blood pressure dose. We're talking very often about something like a quarter or half of a milligram a day for women. Small, but enough to do something. So why is this in the headlines this week? Because a bigger, more formal study has come out giving doctors more confidence to prescribe it. And the press picked it up the way the press picks things up, with the word breakthrough in the headline. That's the cycle. That's why your inbox suddenly has 3 articles about it. Okay, let's talk about who tends to do well on it. The honest answer is women with diffuse thinning or female pattern hair loss, whose doctor has already done the basic work to rule out the simple things. And by simple things, I mean iron, ferritin, which is your body's iron stores, thyroid, the postpartum window, if you've had a baby in the last year or so, sometimes vitamin D, sometimes a scalp condition you didn't know you had. Because here's the thing, if your hair is thinning because your ferritin is on the floor, no pill is going to fix that. You'll fix that with iron. If your thyroid is off, you'll fix that with the thyroid medication. Oral minoxidil is for the kind of thinning that doesn't have a simpler explanation underneath it. So the women who tend to do well are the women whose doctor has already looked underneath and said, the basic things are fine, this looks like a pattern, let's talk about treatment. Now let's talk about who should not start it, or at least who should slow down before starting it. First, anyone whose scalp signal has not been properly worked up. If no one has actually looked at your scalp, asked the right questions, taken bloods and made a diagnosis, you are not ready for this medicine yet. You're ready for the appointment that comes before it. Second, women with certain cardiac conditions. Oral minoxidil works on blood vessels. It's the same reason it grows hair, and it's the same reason it can affect heart rate or blood pressure or cause fluid retention in some women. If you have a heart history, this is absolutely a conversation with your doctor, not a TikTok. Third, women who are pregnant or trying to conceive or breastfeeding. Not the moment, different timeline. And I want to say something gently here. The headline says breakthrough. The reality is, it is the right tool for some women and the wrong tool for others. And a press article cannot tell you which woman you are. Only the appointment can. Let's talk about side effects, honestly. The most common ones, at the low doses women are usually prescribed, are mild. Some women get a bit of extra body hair, on the arms, sometimes on the face. For some women that fades, for others it doesn't, and they decide it's a trade they're willing to make. For others, it's the reason they stop. All of those are valid choices. Some women get fluid retention, a little puffiness around the ankles, sometimes the face in the morning, usually mild, usually settles. Some women feel lightheaded the first week or two while their body adjusts. Usually it passes, sometimes it doesn't. The point isn't to scare you. The point is, these aren't secrets. Your doctor should walk you through this list before you start, not after. Okay, the part I really wanted to get to today. The 7 questions. If you are thinking about asking your doctor about oral minoxidil this week or in the coming weeks, these are the 7 questions I would want you to bring with you. Write them down, put them in your phone, whatever you need. Question 1. What is my actual diagnosis? Not thinning hair. That's a symptom, not a diagnosis. Is it female pattern hair loss? Is it telogen effluvium? Is it postpartum shedding? Is it a combination? You want a name on the page, because the treatment depends on the name. Question 2. What is my ferritin level? Ferritin is your iron stores. For hair growth, most specialists want it well above the bottom of the normal range. If yours is low, fixing that may be the first step, not the pill. Question 3. What does my thyroid panel look like? And I don't just mean TSH, a full thyroid panel, because subtle thyroid changes can cause hair to thin in ways that look like pattern hair loss, but aren't. Question 4. What dose are you suggesting and why that dose? This matters because the dose your doctor chooses tells you a lot about how much experience they have with this medicine in women. Very low daily doses are typical. If a doctor is suggesting something much higher, ask why. Question 5. What is the time horizon? How long until we know if it's working? Hair is slow. 3 months is too early to judge. 6 months is usually when you can have a real conversation. 12 months is when you can really see. If your doctor tells you you'll know in 4 weeks, that's a flag. Question 6. What is the exit plan? Meaning, if I start this and I don't like how I feel on it, or it isn't working, or I decide it's not for me, how do I come off it? What happens to my hair if I stop? Will I lose the gains? You should know the answer before you start, not after. Question 7. What is Plan B? If oral minoxidil isn't the right tool for me, what is? Topical minoxidil, spironolactone, low-level light therapy, PRP, a combination? You want to know that this is one option in a toolbox, not the only door. Those are the 7. Diagnosis, ferritin, thyroid, dose, time horizon, exit plan. Plan B, write them down, bring them in. If your doctor is the right doctor for you, they will not be annoyed by these questions. They will be impressed. Okay, last piece. Here is what I tell women in chair. The day they tell me they're starting. The medicine is a tool, it's not a story. The story is the cycle of care around it. The way you wash, the way you brush, the way you style, the way you protect what you keep. Because even when the medicine works, and it does work for many women, it doesn't undo years of damage in a month. It protects what's living now. It wakes up follicles that still have life in them. It cannot bring back what's gone for a long time. That's the honest part. That's the part the headline leaves out. And I want to be careful here because I know how this lands. When a woman has been thinning for years and she finally hears about something that could help, the very last thing she wants is someone in a podcast telling her not to get her hopes up. That's not what I'm doing. I'm telling you to hope precisely. Hope for the thing this medicine can actually do, which is protect what's living and wake up follicles that haven't fully closed the door yet. That's a real thing. That's worth hoping for. What I don't want is for you to hope for the wrong thing, get disappointed 3 months in, and quit. Right at the moment where, for many women, the medicine is starting to do its quiet work. So hope precisely. Start gently. Keep your routine kind. Be patient with the first 3 months. Don't count hairs in the sink. You will drive yourself slowly mad. Use a soft brush. Wash often enough to keep your scalp healthy. Style in ways that don't pull. Eat enough protein. Sleep when you can. And if you do all that, the medicine has the best possible chance to do its part. Because your part is doing its part too. That's the episode. If this is you right now, if you're walking into this conversation with your doctor and you're not sure what to ask, or you're not even sure if you're ready for the conversation yet, I made you something. A free guide called Is It Just Shedding? A 5-minute self-check for women. It's the same 5 questions I ask in Chair. It's not a sales page, it's just the questions. The link is in the show notes. And as always, nothing in this episode replaces advice from your own doctor or dermatologist. This is the conversation. That's the next conversation. If today's episode was useful, the kindest thing you can do is share it with one woman who needs it. One woman in your group chat, one woman in your family, one woman at the school gate. That's how this little podcast finds the people who need it most. Thank you for listening. I'll see you next week. Take care of yourselves.